My first concussion took place in 2003 when I was playing at Ohio University college soccer. I blacked out in midair and I don't even remember hitting the ground, and I woke up in the hospital.
Concussions are also known as a mild traumatic brain injury. That's a result of an injury to the head or body or a fall, causing a jarring of the brain and the skull. Some individuals may suffer from CTE, which is a cumulative trauma encephalopathy. This occurs when an individual has multiple concussions over a period of time, and this can cause long-lasting symptoms through the rest of their life. In our case study, Isdi suffered 3 concussions, last being approximately 9 years ago.
For the past 9 years, I've been experiencing a little bit of double vision, severe migraines, and fatigue. It's been pretty hindering in my lifestyle. There's been times where I can't sleep because my headaches are that severe. So before the restructured water, I was getting headaches or migraines 3 to 4 days a week. And there's times I cannot go to work, I can't get out of bed.
She performed a VOMS test before we started the case study to see what her numbers and her stats would be prior to starting the water. The VOMS stands for the vestibulo-ocular motor screen. It helps to diagnose for concussion syndrome symptoms. During the VOMS exam, we're looking at her cranial nerves and how they affect the muscles that control her eyes, which in essence will be a reflection of her vestibular system. A couple of the areas where Isdi was positive on her VOMS exam were the convergence and for tracking. And when we did the convergence test, which is looking for diplopia or double vision, I could not even begin to do the test because as soon as I started the test, she already had diplopia and double vision. This category of this result on the convergence equates to her being referred to a neuro-ophthalmologist because that's how serious these findings were.
6 months ago, I started to take the restructured water, and I noticed within 3 to 4 days that my migraines had completely gone away. I didn't have to take any painkillers or anything at night or in the morning to try and survive the days.
Isdi continued to use the water for a period of 2 weeks, and we performed daily VOMS exams and balance testing to monitor her progress. After the complete 14 days, she maintained her scores, which were completely negative, and her balance and her endurance and her headaches were improved.
I'm able to move around a lot better without having to compensate my head motions so I don't get dizzy or I don't trigger a migraine. I've actually been able to take up more athletics like mountain biking and strength training because I'm not worried about anything triggering due to headaches or double vision or irritability or fatigue. My fatigue especially, I noticed, has been different. I'm able to not have to take a nap when I get home because I'm on my feet all day. And when I'm up at 11 o'clock, I actually surprise myself because I couldn't do that before.
Currently, she uses the restructured water in place of normal drinking water and has not had a reoccurrence of her symptoms since starting the restructured water.